My name's Robert Sandmeier. I'm an orthopedic surgeon at the Portland Clinic here at the Tigard office. I'm a board-certified orthopedic surgeon and also in sports medicine. And I'm also a member of the OSAA, Oregon State Activities Association medical panel. And I've been doing it now for about 23 years. I've been the team doctor for one of the local high schools as well as one of the local Division III colleges through most of that time. So I've been sending patients to APEX for about 5 years. And I think there's been a transition in physical therapy over this last, certainly 10 years, where there used to be a lot of places that had their individual distinctiveness, you know, that people were into more athleticism or more, workers' comp is a specialty group. A number of years ago, many of these practices were bought up by big companies. I really think they lost that distinctiveness that they used to have, and that's one of the reasons that I send people here. So the big reason I send people to APEX is that I don't think physical therapy is a commodity. I don't think seeing a doctor is a commodity either. Doctors are different, and there's some that would be better for people to see than me, for example, depending on their problem. But with physical therapy, if you have someone who is exceptionally athletic, especially, and you send them to what I'll call Joe's therapy, and I've been to places where they just don't really have a lot of equipment to work with. You know, they don't have anything heavier than 50 pounds. And this is somebody who easily lifts 50 pounds with one hand and isn't challenged by it, so their body's not changed by trying to do something, I'll call it small. They need something that can be big enough to tax them. Now, you often have to start small, in fact, often start surprisingly small, but it has to build to a level of athleticism where they can compete against that other guy that weighs 250 pounds. So I send people to APEX because you have the facility that lets people actually get back to doing the athletic things that they would do. You have room to throw things, room to run and get up to speed before you have to stop and turn, various weight equipment and other things that can really build up to a reasonable equivalence of competing. Well, we've been talking all about the athletic people, but I think another piece of coming to a place like APEX is, I'm going to call it the attitude. So in a previous thing we talked about resilience a little bit, that sometimes there are times where you have to kind of push through and you have to sort of be challenged. And it helps to be in a place where you can see what other people are doing and you can say, I want to do that, or I want to at least try to do that. And if you go to some place where, you know, the other people are trying to just walk up a couple steps after their knee replacement, they have struggles and it's hard, I'm not disparaging that, but that's not very inspiring for someone who wants to be really athletic again. They want to be someplace where they see somebody that they're better than, so they can pat themselves on the back, and they see somebody they want to be like. I think one of the things I like about people coming to APEX is that they sort of get into it. You know, when I talk to them later when they come back, they really feel like they're getting something out of the session. I've had people go to other places where, you know, they're sort of going through the motions, manual therapy, which I'm not on a mission against manual therapy, but in the end, if your goal is to move your body at speed, no one can do that for you by manipulating and things like that. It has to build until you're really doing that stuff. And APEX is a place where that sort of thing happens. I would recommend, if people are going to looking for a place to go, that particularly for, and it sounds a little like these two don't go together, the people who are already athletic, I think there's a big benefit. But also I think a little bit for some of the people who, I'm going to say, need encouragement. You know, they need to be in an environment that is pulling them in, as opposed to, I'm going somewhere and somebody's going to do something to me for half an hour and then I'm going to go home. And then I'll have a couple, you know, little exercises that I can already do.